I really think that we should have targeted health programs. Again, when we talk about inclusion and diversity, that is so important because, again, when we talk about, again, like obesity or trying to cut down on the risk of the high blood pressure, diabetes, etc., the type of foods, if we doing a health awareness and I'm going to only bring the type of foods that the Chinese eat, the African does not relate to that. So it is really, really important that when we are doing these programs, we should target again. So we want to be inclusive. So the people of color, and not just the people of color, there's a diversity within the color. So when I say anybody who is like from the Philippines, maybe what they eat is different from those of us who are from the Central Africa or the East Africa. The East Africa, the Caribbean is very, very different. So definitely, I would say yes. We need to, and then maybe the type of exercises that the person of color could relate to will be different. There's no one shoe that fits all. So because there's no one shoe that fits all, it is really, really prudent. It's so important that we are mindful of the different approaches that could help. A lot of times I say, okay, simple walking is good for everyone, but not everybody will walk, right? So some people can do stationary biking, but maybe what old mama was like, no way, I'm not going to get on a stationary bike. What can they do? So there are different things that, people of different, I would say, cultures would be able to embrace and apply. So it's so important to work with people, and that could help them to jump on it and take advantage. So yeah, we should have targeted
marketing or targeted programs really speak to the people that you want to help.
Yes.
A general program doesn't really stick, doesn't really catch those people's attention, so we're not really helping them.
And it also tells them that I care enough. I care enough, if I'm talking about, again, like fufu, and versus maybe couscous, the type of fish. If I'm going to say salmon, and these people are from a particular area where there's no salmon. So what are you telling them about, eating salmon? But maybe they know about mackerel, and maybe they can afford mackerel. So of course, like if I'm using an example of a good fish that can help them that has good cholesterol, I'm not going to be talking about salmon. I could be talking about salmon maybe to the Caucasian, but maybe when I'm talking to this person of African descent, I'll say, oh, mackerel. And the mackerel is cheaper, but it also has good cholesterol, and they can embrace that. So also, like I say, maybe they know about riding bicycle, and maybe that's something that they could use, whereas somebody else could go to the treadmill, and the person in the village, they can't even afford the treadmill. So how are you going to help them to make a lifestyle change if they can't even afford it? So I really believe that for a patient or for any individual, even if they're not sick, to be able to embrace what let's say the healthcare professionals or the programs that we are trying to implement in our communities to help the people, if we really, really know where, that, okay, they're from the Caribbean or from Africa, and knowing their history and knowing what they're familiar with, and then we can really, so we're saying to them that you are so important to me that I am not just coming with, okay, this wonderful technology, but I'm saying, let's use what you have, So is it, gathering in the evening and dancing around and just by the fire? Is that what is going to do it for you? And so that's stress relieving, that is fun, and that is exercise, and you're eating the right food together as family, then let's do it that way. But then if the other person can get up and go to the gym, then that's good for them. So there's no one shoe that fits all again.
Maybe somebody can even afford a gym membership, or live in a community where it's crime infected, that they cannot just go for a walk anytime they want, or you have a single parent who has, let's say, all these kids, she has no time to work out. So creating programs that will speak to the people, that's profound. I really like your answer.
Thank you.